Hello everybody. Today I am going to talk about a very revolutionary therapy for treating urinary incontinence called sacral nerve stimulation. Sacral nerve stimulation is a very well established, safe and effective advanced therapy for treating urinary and fecal incontinence. And by incontinence I mean inability to voluntary control your bowel and urination. Sacral neuromodulation is particularly advantageous for patients who have failed conservative treatments like medications and behavioral therapy. The procedure involves implanting a neurostimulator device which delivers electrical impulses to the sacral nerves, thereby effectively modulating the neural pathways and restoring the bowel and bladder function. Various theories are involved, but the most widely accepted theory is that SNS blocks the efferent impulses to the sacral spinal cord, thus inhibiting the overactive bladder muscle, that is the detrusor muscle, and thus relieving the symptoms of urinary incontinence. Patients eligible for sacral neuromodulation for urinary incontinence must have refractory, non-obstructive urinary retention, urge incontinence or severe frequency that has not responded for a minimum duration of 8 to 12 weeks despite adequate pharmacotherapy and behavioral therapy. Individuals undergoing sacral neuromodulation for urinary incontinence should maintain a voiding diary to track their urinary or fecal symptoms and to establish a baseline. This diary can be updated during the period of the clinical trial to look for improvement, with a reduction in 50% symptoms or more considered to be a successful trial. The device consists of a sacral electrode which is inserted into your back into the spinal cord, which stimulates your sacral S3 nerve and which is connected to a IPG, just like DBS and VNS surgeries which I have described in my previous videos. This battery is then implanted into your gluteal region, that is the area of your buttocks, by creating a subcutaneous pouch. This procedure is done under local anesthesia with the patient being awake, and the recovery is almost immediate. This procedure is usually done in two phases, the trial phase and the permanent phase. In the trial phase, the temporary leads are connected to an external neurostimulator. Only if the trial is successful, then the permanent leads are placed and they are connected to the IPG permanently. Once the IPG is connected, the programming is done by using a programmer tailored to the patient's needs, just like the DBS surgery. As mentioned before, if there is a reduction in 50% or more of the patient's symptoms based on his voiding diary, then the trial is deemed to be a successful one. Like with all other foreign implantations, presence of a pre-existing infection is a big contraindication. Also, if there is any obstruction to the urinary flow, like presence of any tumors, etc., then the process is not indicated. Also, if there are any spinal cord defects, then it makes the procedure very challenging. And age itself is not a contraindication, but usually younger patients have a better outcome. This procedure is relatively safe if done by a trained functional neurosurgeon, with pain at the site of surgery being the most common side effect, and lead and IPG migration and infection being the very rare occurrences. Various randomized controlled trials have proved that 80% of the cases have achieved more than 50% reduction in the symptoms. Benefits last for up to 5 years after surgery. Also, for fecal incontinence, 86% of the patients had more than 50% reduction in the symptoms. So to summarize, SNS or sacral neuromodulation is an FDA approved tool to treat the symptoms of overactive bladder, especially urge incontinence and also fecal incontinence too. Patient selection is most important. Younger patients benefit the most. Only patients who show a good response to the trial phase should be permanently implanted. The procedure is relatively safe with few side effects. The success of this procedure depends on the correct lead placement by your surgeon. Excellent results have been observed in well-selected cases with significant improvement in quality of life. Thank you for listening. Feel free to contact us for any queries.